Efforts to eliminate malaria in Nigeria are underway with a focus on reducing malaria morbidity in children. Stakeholders including the Malaria Consortium, WHO, NAFDAC and others has gathered for a two-day meeting to discuss research and uptake of malaria prevention interventions. The meeting centered on the Perennial Malaria Chemoprevention (PMC) intervention being piloted in Nigeria, aiming to prevent and reduce the high burden of malaria in the country. According to the Minister of State for Health and Social Welfare, Dr. Tunji Alausa, the lack of coordination has hindered progress in the fight against malaria. He emphasized the need for funding and assured the ministry's commitment to international collaboration.
So that's and it's the same thing. We're doing the same thing. If you continue to do the same thing over and over and over again, you would not get different results. You'll continue to get the same results. And part of the problem we've had is that there's so much hyper-fragmentation in the way our programs are being designed. The malaria program is designed in the country, and no coordination. You have a PMI in some states, Big Foundation in some of the other states, and a global fund in some states. And there's really no coordination. And then the way interventions were given, we're not necessarily focusing into what works. We go to Kebbi State where you have the rice, yes. Then we're still using high TN. In some areas, mosquitoes are biting during the day. And there are lots of resources that we could use, but some of them are more costly, some of them are less costly. And there are new interventions and new things that we could use as in form of vaccine, which we have to deploy everything.
Dr. Alausa expressed optimism about the research, hoping it will contribute to the elimination of malaria in Nigeria. He praised the progress made so far, acknowledging the efforts of the research team.
I'm very happy with what I've seen here today with the PMC. I know this is also an extension, I would say extension of SMC. The SMC so far has worked from some of the areas in the north that is being deployed. Models are giving a good report back that, okay, our kids are not, we have these young kids and they're not getting sick again, they're eating more, they're playing more, they're enjoying their life more. And now, as I was looking at the PMC data, some of the data you reported that in some, this was done in some other states where you have about 28% reduction in hospitalization, anemia, and for more, and inpatient admission. So those I hope at the end of the day, but I was looking forward to actually getting a bit of raw data here. But for all your presentation, you spoke a lot about design and the challenges that you've seen and how you're going around those challenges. This is very good. I think this is a good meeting, and it's coming timely so that as we move along, this is a 10-month implementation and it's a 24-month implementation timeline, right? So I believe this meeting is coming at the right time. So it will help you prepare for subsequent months as you implement this program. And I like the fact that you're using the EPI platform, which is very robust all across the country. I'm very happy with the quality of people that are participating in this roundtable meeting. I will look forward to the results, and hopefully this will be added as part of our armamentarium in an attempt to eliminate malaria in our country and not just maintaining malaria.
In an interview, Dr. Linda Ozo, National Professional Officer for Malaria, confirmed that the research is ongoing and will be updated every 6 months for 2 years. She provided assurance that the study's finding will be closely monitored and analyzed.
At this meeting, this phase of this meeting, we're very happy with the results that we're getting in the field. It's speaking to the positivity of Nigeria adopting this intervention for the children of this country. And this intervention, like the name goes, is going to be deployed in the southern part of the country where we have the perennial rainfall. So they are mainly the states in the southern part of the country. You have like my state, Abia State, you have Ebonyi State, you have Enugu State. There are also some states in the north central that will benefit from this intervention for the children under 5, specifically from 2 months to 24 months old children. And this program, this intervention, it's going to be running under the immunization program. So we're going to be deploying the SP, the sulfadoxine pyrimethamine, through the EPI platform, to prevent these children from having malaria.
Comfort Olayinka, Eco Hot TV.